forward to talking about what the folks who are looking at this want to hear about.
Exactly. I thought what we'd do today is, of course, we're taking your questions, but Kate has done a couple of presentations this week that I listened in on. One, she presented to all the heads of WHO's country offices, and I thought the way she structured the presentation was exactly the kind of things that you want to know about as well, because we're seeing the same kind of questions throughout our channels. We have colleagues who work on listening and who listen in. They see the types of questions that people around the world are asking. So we're going to talk about vaccines and variants. We're going to talk about vaccine safety. We're going to talk about mixing and matching vaccines, about vaccines in kids, and also about vaccine boosters and other subjects that you bring up as well. So before we even started, we already had a question. Reminder of how you ask your question. You do hashtag AskWHO if you're on Twitter. You can see that pinned in our Twitter feed if you forget the hashtag. Otherwise, on Facebook, LinkedIn, and YouTube, you ask your question in the comments. So we had a question already off the top on Twitter from Obaid Khan, who wants to know, can pregnant women get vaccinated, or breastfeeding women? What do we recommend in terms of pregnant and breastfeeding women and the vaccine? Over to you, Dr. O'Brien.
Oh, such a great question. So first, let's just talk about pregnant women themselves and their risk of COVID disease. So, over the course of the pandemic, we've learned more and more about whether or not being pregnant is something that puts you at risk of having more severe disease. And the answer is yes, it does put you at greater risk. And that's probably more true later in pregnancy when you've got a big belly and your lung capacity is reduced just because of the volume that you're carrying around, that baby that you're carrying around. So that's the reason why we're particularly interested in vaccination in pregnancy. Lots of evaluations now of using vaccines in pregnancy, and our recommendation is that if you're a pregnant woman, there's no reason why you can't get vaccinated with the vaccines that have been emergency use listed by WHO. So there's no increased risk of negative things happening during your pregnancy, and we know that that then protects you as a pregnant woman, protects your pregnancy, and protects the baby that you're carrying as well. So really important that pregnant women understand the importance of getting vaccinated. And the second issue is around breastfeeding women. And there, again, no reason why a breastfeeding woman could not be vaccinated. There's nothing bad is going to happen in terms of the baby or in terms of your own health. In fact, this is going to be protective for you. And still looking at evidence about whether there is the transmission of the antibodies that you produce in breast milk, but for lots of other infections and other vaccines, you produce antibodies, and in fact, you do transmit those through breast milk. So both pregnant women and breastfeeding women, we don't see any reason why you can't be vaccinated.
It's still understandable that people are concerned, right? People are still wanting to understand how vaccines work, needing to understand their own vulnerability. What's a good source of information? When you're confused like that, you're talking to your parents, you're talking to your peers, maybe you're in a group with other pregnant people. What is your recommendation for where to get reliable information to help answer? I mean, you're searching for where's a good answers.
So there is so much information out there on the web, and some of it is credible and some of it is just misinformation or simply incorrect. So what's really important when you're looking for information is to be sure that you're going to credible sources. That means your health department, your Ministry of Health of your own country. It means going to websites from health departments or public health departments of countries around the world that are really following this carefully. And WHO has all kinds of information on our website specifically about the vaccines. And we do provide recommendations for every vaccine that is emergency use listed by WHO and for all of the different risk groups about which risk groups should be vaccinated, as well as any information about how the vaccines are stored and how they're administered. So really, it's important to go to sources of information, public health institutes, ministries of health, the World Health Organization, UNICEF has good information on their site as well. And specifically for pregnant women, for example, there are also physician organizations, so associations of specialists in obstetrics that provide information about vaccination and recommendations around vaccination.
So there are good sources out there. This is a question, another one we received already in advance from Facebook from Honey Praras, who wants to know, is it okay to get other vaccines around the same time as the COVID-19 vaccine? Can I get other vaccines between doses of the COVID-19 vaccine? I know I actually had that question myself because I needed to travel and needed extra vaccines for that. And my doctor asked me, when did you receive the COVID vaccine? What's
Right.
our official answer on that one?
Yeah, so the studies with the COVID vaccines have not looked at what is referred to as concomitant vaccination, so where you would get more than one vaccine at a time during a visit. So for that reason, what we do recommend is that you wait a couple of weeks after you've gotten your COVID vaccine before you would be vaccinated with another vaccine. There's no specific reason why we would think that two vaccines would interfere with each other, but we just don't have the data to be certain about the performance of the two vaccines. The other thing is that if you have any side effects from a vaccine, we would want to know which vaccine it was related to. So that's the recommendation, is to wait a couple of weeks between when you get your COVID vaccine and when you would get a vaccine for another product that you would be vaccinated against. And then you can go on to get your second dose of COVID vaccine.
Thank you, Dr. O'Brien. Some of you might notice that Dr. O'Brien's image is a little bit fuzzy. That happens sometimes. Don't adjust your sets. It's normal, and we can still hear her, and that's what's important. More questions. We have Mohammed Abdul Malek Khan, who says, after getting the first dose of the COVID vaccine, not able to get the second one. What should I do? That actually is a good question that can lead us into a wider topic as well. What should people do post-vaccination in general? But maybe just first on his specific question, he's only been able to get one dose.
So the performance of these vaccines has largely been evaluated following 2 doses of vaccine. The one exception for that is the Janssen vaccine, or also called the Johnson & Johnson or J&J vaccine, which has been studied as a 1-dose regimen. So in general, I'll speak about the vaccines where there are 2 doses that have been evaluated. And for most of the vaccines, there is better protection following the second dose than there is following the first dose. But for some of the vaccines, the protection after a first dose is very strong. So it's not that you're going to have zero protection, but it's not the magnitude of the protection that you're going to have after the second dose. There's no harm to you or harm to the immune response for delaying the second dose. But the difficulty is for delaying the second dose, and I recognize the question was really about unable to get it. It may be a supply issue. The concern is that after a first dose, you don't have the full level of protection that a 2-dose regimen would give you. So what we would recommend is really pay attention to when you're going to be able to get that second dose, and to be sure you go ahead and get it. And this is particularly important as we have variants that are circulating in a lot of parts of the world. And for some of the variants, the performance of the vaccines are much better after the second dose than they are after the first dose. So we really want to emphasize the importance of getting the second dose. It kind of leads to something I wonder if you're going to ask about, Nika, which is mix and match, where you might have gotten your first dose of one product, and can you just get any other product as your second dose, whatever is offered? And the answer to that is that we don't have enough information to give a really general recommendation like that. What we do know is that for the 2 what are called mRNA vaccines, the Moderna vaccine and the Pfizer vaccine, that you can definitely get that vaccine as a second dose after having received the AstraZeneca vaccine as your first dose. So we know that that mix and match schedule works, and in fact, it works quite well. It works really well. But we're going to need more information about other combinations of vaccine and in which order they're given. So just because you can have a mix and match of one vaccine and another in one order doesn't mean the reverse order necessarily performs in the same way. So we'll keep providing updated information about this, but we'd really want to emphasize the importance of getting the second dose as soon as you can, and we will have more and more information around mix and match. At this point, we're constrained to first dose AstraZeneca, second dose either Moderna or Pfizer.
And we're getting more information from countries and from the companies as the studies go on with different kinds of matching regimens, right? We're not saying don't do it. We're saying it needs to be something that's followed. Is that right? I mean, we're not saying don't do it to governments and the pharmaceutical companies. We're saying to the public, until we know better, don't shop around and do it for yourself.
Yeah, that's exactly right, Nika. The studies are ongoing. So we've got a lot of information that's sort of, cooking in the oven. We need to let that information get to completion, and then we'll be able to provide better recommendations. So for individuals, what we're really recommending is you make every effort to get your second dose as the same product that you got with your first dose. As I mentioned, there is some mixing and matching that you can do. But we really just don't have information to be able to say one way or the other for any other combinations, whether there's any problem from a protection perspective. And we're also looking at safety concerns or safety issues to see if there's any increase in the local reactions that people have to vaccines or any other safety issue.
We'll touch on that again later as well, but we're getting a lot of questions on boosters. For example, somebody saying, because the Delta variant is circulating, should I get a booster? Meaning, if you got a vaccine that's normally one dose, should you go and get a second one? If you got a vaccine that's normally to get a third dose. So what is WHO's current recommendation around so-called booster shots?
Yes, we're very clear on this. There's not enough information to provide a recommendation at this point. Again, this is a very hot topic, and there's a lot of research going on to be able to provide an evidence-based recommendation. So we are not recommending boosters at this point because there isn't enough information to provide an answer to the question. We do know that there are some countries that have started to recommend boosters. We're really encouraging all countries to follow the evidence and to only proceed with a booster regimen on the basis of evidence. So we will continue to follow this super carefully. And so for people out there, we are not recommending boosters at this time. And if boosters are recommended, they would likely be recommended for a constrained set of people, especially perhaps people who are elderly or who are at highest risk of serious disease. We will also be looking at recommendations on a product by product basis because not all the products are exactly the same. So at this time, we do not recommend booster doses for any of the products.
I think for now as well, WHO, our Director General, has been very clear on this. If a country has excess capacity, if a country that has vaccinated its healthcare workers and vulnerable population and has excess capacity at that time, we recommend that that country share those vaccines with a country that hasn't yet had a chance to vaccinate their vulnerable people, their healthcare workers, their frontline workers, and people who are vulnerable. Other people who are vulnerable, essentially. So there's an equity message there as well. It's two-track. I think we're not saying don't do a booster because there's not enough. We're saying we're still looking at the science on that. In the meantime, as we're gathering the science, if you have excess doses, the right thing to do to slow and stop the pandemic eventually is to share. Is that a good way of summarizing it?
Yeah, that's a great way of summarizing it. And I think everybody's just really used to now the idea that as we get more information, we will update the recommendations. And you're seeing that coming out of all kinds of different countries. We're asked a question on one week and we don't have enough information to answer it. And we'll always tell you that. We'll always tell you, we just don't have enough information to provide a recommendation on something. But several weeks later or several months later, more of the research has come in, and we then do have an answer to the questions. So at this point on the boosters, we're really saying we don't have enough information yet, so we can't make a recommendation. We wouldn't know whether that was needed or not, and we certainly wouldn't know it on a product by product basis. And if countries are going ahead and starting to deploy boosters, it does worsen the issue that we have that there's insufficient supply at this point for every country to have vaccinated all of their highest priority groups and then down into lower priority groups. So really important, the message that you just had, Nika, is that countries are now sharing a lot of doses. We've got over 550 million doses that have been shared by about 15 or 16 countries so that those can be deployed in countries that don't have as much vaccine access. And really what this is about, and I think everybody's experiencing it now, there's no one country that can get out of this on their own. The variants are going to emerge unless we're vaccinating everywhere. And those variants are going to move from country to country. So you can't sort of get ahead of this unless we're really in this all together, not just for a sort of justice reason or moral reason. It's really on the basis of what the biology is of this virus and making sure that we can end this pandemic and get back to normal.
Which we will be able to do eventually. I know it's hard to believe that when in some countries, especially when they're in the midst of a really difficult time right now, and sympathies to people who are struggling in those countries, but we will get through it eventually. We're just not there yet, unfortunately. Here's a question from Facebook. Cheyenne Barra asks, why do people have fever after getting vaccinated? I know that happens with some other vaccines as well, but more specifically on this one. And I know it's not scientific to say me and my friends, but in my circle, there have been people who've had, achy joints, feeling unwell, feeling a little fluish, sometimes even bad enough that you want to take a day off sometimes after the first dose, sometimes after the second. So what's happening inside our bodies? And related to that, does that mean there's something wrong with the vaccine? Is that unexpected?
Oh, this is such a common side effect for people who are getting vaccinated for not just the coronavirus vaccines, but all kinds of vaccines that we give at different ages. So what's happening in your body is, when you give a vaccine, what we're doing is we're giving something to your body so that your natural immune system starts to recognize a portion of the virus, in this case, that we want you to be protected against. And so that's training your immune system so that when it sees the real virus in it, in the real setting, you've already got a whole defense system that can recognize that virus and kill it as soon as you're exposed. So when you give a vaccine, your immune system is starting to see this teeny tiny part of the virus or a particle in the virus that your immune system is going to react to. So part of these symptoms that people have is really about the response of your body to the vaccine itself. And these are very generally, the vast majority of people are self-limited. It means they'll go away in a short period of time. And they're usually mild in nature, although for some vaccines and for some people, you may feel unwell enough that, maybe going to work that day doesn't seem like a very good idea. And really, it's about treating your symptoms from just a symptomatic perspective, taking an anti-inflammatory, if you're not feeling well, headache, low-grade fever, soreness at the place where you got your injection. And yes, it's true that depending on which vaccine we're talking about sometimes, and depending on which age group, sometimes the reactions are a little stronger or more frequent with the second dose, and sometimes the other way around. I know when I got my second dose, within a couple hours, my arm was really quite sore. And I guess I just took the perspective like, good, something's really happening. And if you don't have symptoms, if you don't have side effects, it doesn't mean the vaccine isn't working. So the converse is not true. And I think really just being prepared that you might have some pretty time-limited side effects and just manage them symptomatically.
So side effects, there's some normal ones, expected ones. WHO has information on that as well if you're interested. But then what about the very rare occurrences? I think for all of these vaccines, they've been used enough and widely enough that it's possible to see some rare events, but actually have incidents and reports of these rare events. So what are some of the rare but concerning and serious impacts of some of the vaccines, and what should we do about it?
Yes, safety of vaccines is one of our top priorities, and frankly, it's the top priority of every program around the world that's deploying vaccines. We give vaccines to otherwise healthy people. They're preventive. So from a perspective of what's important in vaccine program, safety is paramount. So we do monitor the safety of all vaccines that are deployed around the world, looking for the detection of rare events. And for these vaccines, there are now over 3.6 billion doses of COVID vaccines that have been deployed worldwide. So we have a really good feeling. We have a really good set of data, a very good understanding of whether or not there are rare side effects from these vaccines. Again, a growing body of evidence. So for a couple of the vaccines, there have been rare significant events that have been identified. For the mRNA vaccines, we've seen inflammation of the heart or the tissue around the heart, generally mild cases, and generally speaking, more common in young men than older people or in young women, and resolving over a relatively short period of time. The second rare but significant side effect that we've seen is with the vaccines that are called adenoviral vector vaccines, so the Johnson & Johnson vaccine and the AstraZeneca vaccine. And that significant side effect is called TTS. It's low platelets with a clotting problem, sometimes a clot that occurs in and around the brain, other times clots in other parts of the body. So these are looked at very carefully. There are ways of treating these clots. And what has been assessed is that, first of all, these are very rare events. And secondly, they can be managed and treated. And thirdly, the reason that we're giving vaccines, the reason we're offering COVID vaccines is because we have a pandemic and each of us is at risk for getting serious disease from COVID. And so the benefit of the vaccines overall outweighs this very rare risk, but this does need to be monitored. And certainly for anybody who is having symptoms that might relate to one of these rare events, it's super important to go immediately for an evaluation because there is management that can take place.
So what are those symptoms? Because we know, often when you go and get the vaccination, you're told what you could expect. Like you said, sore arm, low-grade fever, some achiness, feeling generally unwell. What are the symptoms that you should perk up and say, this is the normal side effects and I should seek medical attention?
So probably the one that we should point to most and sort of talk about most is this TTS syndrome, or this, where you can have a blood clot along with low platelet count. And so the biggest thing that we want people to know about is if you have severe headache and persistent severe headache, that may be especially headaches that begin sometime since the vaccine, so not immediately after the vaccine, but a persistent severe headache would certainly be something that having received either the AstraZeneca vaccine or Johnson & Johnson vaccine, that you should seek medical care for. High fever is another symptom of this, and clots can occur in other parts of the body as well, so shortness of breath, swelling of a limb, abdominal pain. So those are a series of the symptoms that people should be alert to. These are not sort of normal symptoms that you think, I just don't feel quite well. They're really significant symptoms, and you should seek medical care if any of those happen. On the heart, the myocarditis and pericarditis, these are mild cases of inflammation. Again, what people experience is shortness of breath, can be chest pain associated, can be a fever as well associated with those cases. So those are, again, usually mild cases, but should result in people seeking medical care so that you can have an assessment done.
Thank you, Dr. O'Brien. In case you've joined us a little bit later, my name is Nika Alexander. I'm part of the communications team here at WHO. We're speaking today with Dr. Kate O'Brien, who's the Director of Immunization and Vaccines at the World Health Organization. And we're speaking today, as you've heard so far, about vaccines, COVID vaccines to be specific, although Kate, you also work on other vaccines. So we started off today saying we wanted to talk about safety, mix and match, boosters. We've touched on all of those, and we said we want to talk about vaccines in children. We have a question now from on LinkedIn from Samia, who wants to ask, do you recommend vaccination of children?
So first we'll talk about adolescents and we'll talk about children. And we generally refer to adolescents as those people who are 12 years of age and older, and then children as those who are under 12 years of age. So the first thing to say is that there are only 2 vaccines that have been authorized for use in children below 18 years of age or below 16 years of age, depending on which vaccine we're talking about. And so the 2 vaccines that have authorization for that teenage age group are the Moderna and the Pfizer vaccine, although only the Pfizer vaccine has been authorized in that age group by WHO. We're still evaluating the Moderna vaccine for that age group. So we don't have a lot of vaccines that have been looked at and studied for both their immunogenicity and their performance and their safety in this age group, but we do expect more information coming on the other vaccines. The other age group, the children, the under 12-year-olds, there are actually no vaccines that are authorized for use in that age group yet, but the studies are actively ongoing, and we do expect that there will be enough evidence to start dropping the age group, and it won't probably come all at once. When I say enough evidence to sort of drop the age group, that means about authorizing the use of the vaccines in children. And that's a different question than can they be used? That's a different question than should they be used. So when we look at the benefit and risk of vaccines, we really do have to say, well, what are we giving the vaccine for? What are we trying to prevent? And what's curious about coronavirus is this coronavirus is that children actually are not the group that are at significant risk of serious disease, nor hospitalization, and certainly not death. That's not to say that there aren't cases that occur, but generally speaking, compared with all other age groups, children are really not experiencing the disease in the same way that adults do. So it's not really the group that we're primarily concerned about. The other reason that you might want to consider vaccinating a child or an adolescent is, well, can you protect them from either acquiring the infection, even if they don't get very sick, and can you protect them from passing it on to somebody else? So that's transmission. And we still don't have enough information about how the vaccines and the degree to which they're actually protecting against transmission. We've got a lot more information than we used to. And there definitely is some effect of these vaccines on reducing transmission, reducing infection. But curiously, young children are not the major age group that is transmitting this virus. And so we don't have a really sort of overwhelming, compelling reason at this point, given the supply constraints, to be sort of racing ahead and vaccinating children. We do imagine that there may be a pretty strong case for doing that in the future when we have more certainty and more clarity on the evidence. But at this point, we're really focusing on making sure that all adults in the world get vaccinated and protected. And for adolescents who have an underlying medical condition that puts them at significant risk of COVID disease, that may be a reason why that subgroup of adolescents should be vaccinated, but we're not recommending at this point a general adolescent vaccination program, in large part because of still some uncertainties in the scientific evidence and the supply constraint that we're all living under right now. And again, we don't yet have any vaccines authorized for children under 12.
Thanks, Dr. O'Brien. I think that answers a number of questions we had. We had one from someone working in Ireland who wanted to know what we recommend to younger people. We had on Facebook, Shane Rowley wanted to know what about children, what's best for 2 to 12-year-olds. You answered that one. Also on Facebook, Johari Akasim wanted to know, why do some countries allow adolescents or children 12 to 17 to be vaccinated and some don't? So we're getting at a lot of these. You said that children are, and we've seen that children are not the primary most vulnerable, but in some countries where the health systems have been overwhelmed, there are reports, sometimes of very many children dying. And it's a small proportion of a large number of cases, but it's still heartbreaking whenever a child dies. So just wanted to make sure we mentioned that as well. So we've touched on boosters, vaccines, mix and match safety. Let's talk a little bit more about variants. People wanting to know whether the vaccines still protect against Delta, Alpha, and so on. Either, however you want to do it, Dr. O'Brien, but please let us know how we gather information about that. So we have what we recommend, but how do we get to that recommendation? So over to you on variants.
Yeah, so let me say a couple general things, and then we can maybe dive into some of the specifics. So generally speaking, for the vaccines that are authorized by WHO, so emergency use listed, those vaccines are they're maintaining their performance against the severe end of the disease spectrum, against most or all of the variants. Now, that's true for the combinations of vaccine against different variants for which we have evidence. One of the issues here is that we have some gaps in the evidence. And so we're very active in gathering what is being studied, and we'll talk about how we study these things so that we have a full understanding of, for every vaccine against every variant, what is the performance. So the good news is, generally speaking, these vaccines are maintaining very significant protection against severe disease and against hospitalization. Some of the vaccines have lost some of their performance against the very mild end of the spectrum of disease or infection. And we're less worried about that, because really what the purpose of these vaccines at this point is to stop and protect people from getting serious disease. So that's the sort of good news at this point. Not that the variants are good news at all, but the vaccines that we have are continuing to work and people can have confidence in them. And the way that we actually understand about variants and how the vaccines are working is there are really kind of two big pieces of evidence. One is looking at the antibodies that people develop in their blood when they're vaccinated, and then in a laboratory looking at whether those antibodies can neutralize the ability of a virus to replicate, to reproduce, and whether those antibodies basically interrupt the virus reproducing and infecting cells. So that's sort of laboratory-based evidence on the immune system. And then the second big piece of evidence that we look at is actually the performance of the vaccines in the context of a place where a variant is circulating a lot. And we look at the cases that occur among people who are getting sick and whether they're variants or not. And we determine whether people were vaccinated and nevertheless got sick. And we compare them to people who were not getting sick and how often they were vaccinated. So we actually look at disease evidence to look at the performance over time and look at the performance in settings where there are variants circulating. And so it's those two pieces of information that lead us to our conclusions about what the performance of the vaccines are.
So from the literally microscope and lab work, WHO doesn't conduct, but we that information is shared with WHO. We work with a lot of researchers. So from the micro level to the population level, we're looking at population level statistics and what's happening in a place at that level. I think that's what you're saying. You touched on something here, and I would like to unpack it a little bit, speak about it a little bit more, because I know people are still confused about this. You said that the vaccines so far, the vaccines that are in use that WHO has approved of, and that some regulatory authorities have approved for their settings as well, that they work as well against the variants as they do against older versions of the virus. And you said that they protect people from severe disease and from dying, and not 100%, but very much they provide very good protection. So talk about that milder side. And we have questions on that. Can people who've been fully vaccinated 2 weeks after the second dose, is it still possible to catch the disease?
Absolutely. So these vaccines, there are no vaccines that are 100% protective in 100% of people who are vaccinated. And these vaccines are no different. They're very high performing vaccines. They provide incredible protection, but it's not a guarantee. And so we are going to have breakthrough cases. Those breakthrough cases are the kinds of cases that occur in somebody who's already been vaccinated, and nevertheless they get sick. That doesn't mean that the vaccines aren't worthwhile, and it certainly doesn't mean that the vaccines aren't working. It just means that the vaccines are not 100% protective in 100% of people who have been vaccinated. And I guess the analogy I like to use, maybe it works for some people, I'm not sure if it works for everybody, but is seatbelts. We know that seatbelts are incredibly effective at protecting you when you're in a car accident, protecting you from serious injury and protecting you from death. That doesn't mean that it's impossible for you to have a serious injury or in fact, the most serious thing, to die if you're seatbelted and in an accident. But it sure reduces the chances that that is going to happen. And so the same is true with vaccines. It's not a guarantee that you're never going to get disease from COVID, but it reduces the chance that that will happen by very, very substantial amounts. And I want to bring this back also to the question of the boosters. So one of the reasons why boosters might be needed is that the performance of your vaccination protecting you may not be durable over time. Maybe that protection lasts 1 year, 2 years, 3 years, 4 years. We don't know yet how long that protection lasts. So that would be one reason for a booster. Another reason for a booster may be that if vaccines are not performing as well against one or another variants, getting another dose and boosting your immune response may provide better protection. So there are two reasons for boosters that we're looking at and studying whether or not they're needed. And so that's another issue that comes into the performance of the variants, the performance of the vaccines against the variants. But at this point, vaccines are working well against variants, especially for the severe end of the disease spectrum. We do see some slippage. I mean, it's not identical. It's not exactly the same as the non-variants. We do see some slippage, but it's maintaining very high performance.
Question on Twitter: can people who are fully vaccinated still spread COVID? So it's related to what we were just discussing.
Yeah, and this really comes back to this question of, we all want to take the masks off. We all want to get our masks off. We want to be able to hug people. We want to live a normal life. We don't want to have to do all the things that we have been doing our very best to do. And the answer to that is yes, a vaccinated person is at lower risk of getting infected and transmitting it to somebody else, but not at zero risk. So you may not know that you're infected. If you're vaccinated and you become infected, you may not get sick at all. You may be completely asymptomatic, but you're still at risk of transmitting that virus to somebody else, albeit a lower risk than you were if you were unvaccinated. So this is one of the reasons why it's important at this stage, when in every country, the number of people who have been vaccinated is not at the point that it needs to be. So this is the reason why we continue to message to say, please keep your mask on when you're interacting in crowded circumstances, when you're in indoor spaces that are public spaces. Now is really not the time for us to take our foot off the pedal of trying to really crush the transmission of this virus. If we have lower transmission while we're immunizing, while the number of people who are getting vaccinated is going up in countries, it gives the vaccines a much better chance of getting that immunity in a much bigger population. And then when we start to take the masks off and take our foot off the pedal a little bit, slowly and carefully on those other public health and social measures, there's a much better chance that the vaccines are going to be there to protect people.
I think that's important to reiterate as well. We're not saying wear masks forever, meet people outside forever, keep windows open forever, and so on. We're saying that's for now, while the virus is still transmitting in your community. You need to continue to do all those things, even if you're vaccinated. Because I think sometimes people are frustrated. They say, well, I got my vaccine. Doesn't that mean no masks? Doesn't that mean I can go on a cruise with several thousand people? I mean, isn't that why I got vaccinated? And I think what you're saying is, no, the reason we got vaccinated is to protect you from getting very, very sick, and to protect you from dying, and to prevent you from helping to reduce the chances that you could pass the virus on to somebody else who's quite vulnerable. But it's not to protect you from wearing a mask, essentially.
Yeah, not yet. We're going to get there. We are going to get there. but it's just not yet. And we're in such a better place in some countries, but not in all countries yet. And that is the pressing challenge right now. That is the pressing issue right now is we are not going to get out of this more quickly by having some countries go really fast on vaccination and other countries, just not having the supply available in order to immunize their population. This is why the equity issue is so important. Viruses are going to continue circulating and are going to move across borders. So making sure that vaccines are available and deployed in all countries is going to be the fastest and most effective way for us to get out of this pandemic.
There's a little side debate going on about choice. What's WHO's view on vaccine mandates, on mandatory vaccination? And I think this applies to other vaccines as well.
So this is a delicate issue for a lot of people. Nobody wants to be told they must do something. So in general, what we have as an evidence-based organization, there are countries that have vaccine mandates, not necessarily for COVID vaccine, but for instance, vaccines in order for a child to be entered into school or for other reasons. There are also workplace settings where for the reasons of protection of people that you're working with, so especially hospital settings, that there may be parts of healthcare facilities where it is required for individuals to be vaccinated. Now, those aren't mandates. It doesn't mean you must get vaccinated. There, of course, is flexibility around where you work. So if you're not willing to be vaccinated, then maybe that place is not the best place for you to sort of have your employment. But in general, what we've observed and what we know about vaccines is what works best is for people to be informed about the value of vaccines, to understand the benefit risk of the vaccines, to have confidence that they will be able to get a vaccine when and where they go to seek a vaccine, that the services that they're provided are high quality services, and those are the best vaccine programs. There are some countries, and they have a cultural context to them, where it's acceptable in the population for there to be more specified rules around being vaccinated for specific activities or for specific businesses or workplaces. And in some countries that works well, and in other countries that have tried those kinds of mandates, it actually has not worked at all. So this is really country specific, and we would always prefer that vaccines, like any kind of medical offering, is one that people avail themselves of by choice, understanding what the benefit is and why they would be choosing to do that. So that's where our focus is on assuring that people have accurate and credible information about what the benefit is of these vaccines.
Thanks, Dr. O'Brien. Next, we have a question from Facebook. We have more questions than we can answer, but we're hoping that when we cover these topic areas, it gets at lots of your questions at the same time. So on Facebook, Nikki Bako-Swan is asking, what is the research or evidence for those who have had COVID and then get the vaccine, or should they get the vaccine? In fact, what is our advice for people who have had the disease? Do they still need to get vaccinated?
Yes. So for people who have had COVID disease and confirmed COVID disease, there is strong evidence that you have, generally speaking, an immune response to that infection. And we're continuing to observe and study for how long that immune protection lasts after a natural COVID infection. So we do, in our guidance around vaccines, is we do recommend that people who have had infection nevertheless go ahead and get vaccinated. And the reason for that is several-fold. First of all, we don't have enough information about the natural infection and protection against variants. We also don't know for how long that natural infection immunity lasts. We don't want programs excluding people from vaccination on the basis of having had disease in the past. And we certainly don't want programs to start instituting a testing program to try to distinguish those who have and haven't had natural infection. So we do recommend that you go ahead and get vaccinated because people may have are likely to have some degree of immunity for 6 months, perhaps more than that. From a personal choice perspective, people are certainly informed that they could defer the timing of their vaccine if there's a shortage in their community and allow someone else to sort of go ahead of them in line, knowing that they have some level of protection for on average about a 6-month period, and we're continuing to watch to see if it's more extensive than that. But we don't recommend that you avoid getting vaccinated if you've had COVID disease. You should go ahead and get vaccinated anyway.
There's no simple answer, is there? I mean, every one of these questions, there may be a yes, no answer, but there's a lot of thinking and analysis and research behind it that brings us to that answer. So we're going to wrap up really soon, but I just wanted to throw in one question related to travel. So countries, people who are wanting to travel are sometimes finding that the country they're going to doesn't recognize the vaccine they got in their country, or their country they're going to, basically that there's some countries that are quote unquote discriminating based on the type of vaccine you've received. What does WHO have sort of a blanket statement around that? What are we advising countries? Because individuals can't really do much about it. We're not saying you should go and get another type of vaccine so that you can travel. So what's our advice to countries around which vaccines they should recognize?
Yeah, there are a couple issues around this, and I'll go through them quite quickly because we're coming to the top of the hour. The first is that there is, WHO is very clear that there should be no requirement of a vaccine for travel. There are only the yellow fever vaccine and for some settings, polio vaccine are vaccines for which there is a requirement for entry into the country. And that is not true for COVID vaccines. So there should be no constraint for people to be able to travel based on their vaccination status. However, we do recognize that the conditions of travel may be altered by countries based on your vaccination status. For instance, if a country has a policy that people who are entering the country must quarantine for a period of time, that may alter depending on your vaccination status, which is a credible thing because of evidence around whether or not you are protected as a result of vaccination. So no requirement for vaccination to travel, but adjustment of the nature of the requirements upon entry. So the second thing is that we are very clear that we do expect that countries will recognize the vaccines that have been authorized through the emergency use listing procedure for WHO. So if it's a WHO authorized vaccine, these should be recognized by countries. Those vaccines all meet the criteria that were set out for performance of vaccines for COVID. So those are two sort of important things. And we take this very seriously. We're working with countries to, in any circumstances where that's not the case, we're working with countries to urge, cajole, work with them about how rules or laws may be changed to allow more free recognition of the vaccines that are emergency use listed. I did want to mention one other thing, Nika, that's not about travel, but is about school that we didn't get to when we were talking about childhood vaccination. And one of the things is that really childhood vaccination or adolescent vaccination should not be a requirement of reopening of schools, nor of attendance of schools. What we're really concerned about is actually adult disease and adult risk. And so the adults who are working in schools, that's the priority group who should be vaccinated. And absolutely, children and adolescents should not be limited from attending school based on their vaccination status. So I just wanted to be clear about that. Getting back to school and leaving schools open, except in the most dire circumstances, is a critical part of the health and welfare of children and of adolescents.
Thank you, Dr. O'Brien. So we're going to wrap up now. So just a few housekeeping issues. So that was Dr. Kate O'Brien, Director of the Department of Immunization and Vaccines at the World Health Organization. My name is Nika Alexander. I work with the communications team. And other colleagues who are working on this as well, who have been scanning for your questions, who set up these lives each time, who ensure that the technology works and it gets from us to you. So thank you to the team who are working on this. I'm going to name some of the countries where people are watching us from today, and then we'll let Dr. O'Brien say goodbye to you as well, and then we'll wrap up. So some of the places we have had viewers from are Nigeria, France, India, South Africa, Bahrain, Malaysia. We just opened a new country office in Bahrain this week. Our Director General was there. I hope you were able to watch. The Democratic Republic of the Congo, Turkey, Italy, the US, Zambia, Ghana, Laos, Ivory Coast, Bolivia, Australia, Spain, Germany, Kenya, and others as well. So thank you so much for watching. Any last words from you, Dr. O'Brien?
Last thing to say, people ask me all the time, which is the best vaccine to get? And my answer to that is whichever vaccine you're offered. So really encouraging you to share credible, factual information with your friends, your family, your colleagues, and we're all in this together. We're all looking forward to getting to a new normal and doing your part to make sure that you stay safe. You keep your family safe and your community safe. Wear masks, distance, hand wash, outdoors, keep windows open while we get through this and while we all get vaccinated. We will get through this together. We're just not through it yet.
Thank you, Dr. O'Brien. Thank you very much for watching. We don't know when the next Facebook or when the next Q&A live will be, because we do these based on what you're interested in and which experts available to answer those questions. So we'll probably have one next week. We're not sure what day, but keep watching on these platforms and you'll get an alert when we have the next one set. Also, you can always watch our press conferences on the social media platforms. There's always links when the press conferences happen as well. So thank you very much. Thank you, Dr. O'Brien. Get whichever vaccine is available to you and stay safe. And we'll see you again soon. Bye-bye.